Hi, this is Tony Lin. Welcome to my video. After we started the COVID-19 vaccine program, I started to hear all kinds of weird diseases that I never heard of before. For example, myocarditis and pericarditis. These are the confirmed side effects by CDC from taking the COVID-19 vaccine. However, there are even more diseases that I never heard of from the CDC's their database. And today I'm going to introduce you a disease that could be very serious and deadly. It's called Guillain-Barré syndrome, as known as GBS. This is the confirmed side effect from the flu vaccine. And however, I also found many people got this disease from the CDC's database during this pandemic. The reason the GBS is a horrible disease is because some patients they may not fully recover in their entire lives. That means they could be paralyzed for their entire lives. The reason I want to introduce you these disease is because a lot of CDC they don't want to do their job to inform you. So that is why I go inside their database to find out what kind of the disease you could get after you get this. So whenever you see people get this disease, and you can make a better judgment to go to the hospital and get the treatment right away. So without further ado, first let me play the video so you understand what is exactly is GBS.
The first signs of GBS are often a weakness or tingling in your legs. Think about it. The nerves in your foot extend all the way up to your brain. There's a lot of places for a message to get lost. As GBS progresses, numbness and weakness usually spreads up your body, and in some serious cases, that can affect your breathing and facial muscles as well.
So you heard that it could affect your breathing. That is why GBS could be deadly as well.
Recovery from GBS may take 6 months to 2 years or even longer, and many patients continue to have long-term recurrences of fatigue and/or exhaustion, as well as pain, numbness, and muscle aches.
Yeah, so you heard the recovery period could be very, very long, and some patients they never recovered, so they have to sit on the wheelchair or have a special equipment to help them move around for their entire life. So before I dive into the data, let me share the source of the data is from this web address, wonder.cdc.gov, and this data is indeed from the CDC. I'll include the link for you. If you don't believe me, go ahead, be my guest to look up this information from the CDC. So you can see if you do the search on the COVID-19 vaccine, you can find 801 cases of GBS in the entire United States. And here is the CDC, the information. Each year in the United States, an estimated of 3,000 of 6,000 people develop GBS, Guillain-Barré syndrome. So from the CDC database, since last year, entire year, we have 800 cases of GBS. You might think this is just a portion of these 3,000 to 6,000 people. This is no big deal. However, you have to understand only a very few patients, they will submit their data to the CDC's database. So it could be much more than 800 cases of GBS inside the CDC database related to the COVID-19 vaccine. So let me go a little bit deeper to check some of these GBS cases. So here is the patient information. Patient age is 71 years old, sex male, state Ohio, and date vaccinated 2021 January 16, date of onset January 30, and vaccine manufacturer Pfizer Biotech. So symptoms, there are so many symptoms, but today I'm just going to focus on the Guillain-Barré symptom. As you can see, there are lots of problems you could get. So GPS is just one of them. So here is the detail. January 30th began with a spiking BP, blood pressure, I think, extreme pain in right shoulder, taken to ER. Given pain medicine, BP came down and sent home. However, after a couple days, February 2nd, 2021, spiking BP, again, chest pain, numbness, and tingling hands and feet. Taken to medical center, admitted. Series of heart and brain assessment done. Each day he got weaker until he could no longer stand, walk, arm and hand strength depleted, and dexterity issues. Spinal tap on February 8th, 2021, revealed Guillain-Barré syndrome. February 12th, admitted to the rehabilitation center. February 15th, at hospital, plummeting blood pressure. And February 18th, returned to the rehabilitation center. So you can see GBS is a horrible disease because you could not walk like normal people do, and you need someone to be around you. Otherwise, you cannot take care yourself. So let's see another case. So this time the patient is 32 years old, female. Sex is female and stay from New Hampshire. Date vaccinated April 7, 2021. Date of onset April 9th, 2021. And you can see this patient, she took 2 doses of Moderna. And of course she has a lot of symptoms, but today I'm just going to show you the Guillain-Barré syndrome. Here's the detail. After receiving the first dose of Moderna vaccine, I developed a severe headache and COVID arm, a raised red rash on my right arm that was painful, warm, and itchy. After receiving the second dose of the Moderna vaccine, my COVID arm returned, along with body chill and aches and severe back pain akin to back labor, and a severe headache. After about 48 hours, all but the chills subside, and I was left with pins and needles type of feeling in both of my feet. On April 19, 2021, I noticed a tingling feeling creep up my legs and into my calves. On April 20, 2021, it progressed into my fingertip and my leg feels weak. I went into urgent care where they took vitals, my temperature, and did a brief exam. The nurse practitioner called the hospital neurologist, who ordered a blood work and fit me into is scheduled that afternoon. Blood work consisted of full metabolic panel, B12, thyroid, HIV, and the lines. All results were normal except for the lymphocyte count, which was elevated to 3.6. Following the blood work, I met with doctor who did a neurological exam and ultimately gave me the diagnosis of acute inflammatory demyelinating polyneuropathy, AIDP. So AIDP is another name for the GBS. Today, April 21st, 2021, the tingling has progressed into my knees and fingers, and my legs feel more weak than yesterday. So very typical, the GBS symptom. It starts from the further is the part of your body from the leg and progress to the knee and the calf. We didn't hear anything after April 21st, so we didn't know exactly what happened to this patient. All I can do is good luck. And we also know that CDC, they don't do any confirmation on these their own database. So even though you can see 800 people they suffer from these GBS, but there is no follow-up from the CDC. Then what is the point the patient submit these information to the CDC? And if you don't do the follow-up, then how could you prevent the same problem over and over again? GBS is a side effect from the swine flu vaccine 45 years ago. After decades, you still have the same problem for the COVID-19 vaccine. If CDC never follow up with these patients, then how could they improve the safety of the vaccine over the years? And you can see over the 45 years from the swine flu vaccine until now, it's already 45 years, and still the same issue happen over and over again, and there is no cure or improvement. That is why I want you to do me a favor to share this video to inform people about this GBS. So when more people are informed about this GBS, then they will be better prepared for the side effect like this GBS. They know where to get the treatment before the problems is getting worse. And also, when more people are aware about the GBS, we can push the CDC to do more improvement on the vaccine. Otherwise, when next time there is another horrible transmissible disease, who is going to risk their life to take the vaccine, knowing that there could be a chance getting the disease like GBS. So again, click the like button so more people can be informed. Subscribe to my channel so you can always get the latest updates about the COVID-19 and the vaccine. Thank you for watching today's video, and have an amazing day. I'll see you soon in my next video. Bye.